Need to give consent.
All right.
You're not in full screen at the moment for the slides. We can sort of see your background.
All right. Is it working?
Okay, now we can see your screen.
Yeah, I think
You're not in full screen
We're good
at
to
the
start.
moment for the slides. We can sort of see your background.
All right. Is it working now?
Can you see your screen?
Now we can see it.
All right. It's working now.
Yeah, it is. It looks good on YouTube to me. I would just
Okay,
ask everyone
great.
to keep their microphones muted. Thank you.
See your screen.
Now we can start.
All right, great. Well, welcome everyone. Good morning, good afternoon, and good evening. Today, we are thrilled to be launching our knowledge exchange series with this webinar and to present our case studies on contribution analysis. The schedule for the hour is as follows, and apologies for the delay. I hope everyone can see me and hear me well in the meantime. All right, we will start with our opening remarks and introduction, and then we will go through our case studies. We had a brief problem, and we won't be having our Zimbabwe case study. However, during the moderated discussion, we'll have the opportunity to delve deeper into the key reflections from each case. As always, we encourage you to ask questions and share your thoughts in the chat throughout the session. I will hand it over to the team to briefly introduce themselves and to Fabrizio for a quick introduction. Once again, thank you so much for joining us, and we hope you'll find today's webinar informative and engaging.
Thank you, Yasmin. It's a great pleasure to be here. My name is Fabrizio Rigu. I am a senior associate at Eval. It's really, really wonderful to be able to kick off our knowledge exchange series, which is a series of webinars that we're going to hold in 2023 with our extended network of consultants, as well as some guests, to discuss themes that are relevant to the practice of evaluation. The purpose of this series is to engage with our network of consultants, to be able to learn from their experience, share that experience with the rest of the team, so that our evaluations can benefit from the application of those principles, and then we can learn from what worked and what didn't work, and build an increasingly more precise and applicable and relevant body of knowledge. We decided to start out with contribution analysis because recently this has been the approach that we've used the most and that we think is more relevant, especially to program evaluation. As you know, we have a wide array of evaluations that are related that work at the program level. So especially for UNICEF, and the experiences that we're going to bring in today are from UNICEF programs that we've evaluated. So this is not project level stuff. This is not policy or thematic evaluations. They're focused on programs that last over the years, and especially because the learning that comes out of this evaluation may be used to improve the program in the future. If it were a project, then it would be more of a self-contained evaluation, and we would take the recommendations and expand them to other projects. But in this case, since the program is more or less continuous, then the learning aspect is very important. So we chose contribution analysis as an approach to evaluation that produces actionable learning. About the introductions, I'm going to speak briefly about contribution analysis and go over what it consists of, and then I will hand it over to our guests who are going to do the presentation, and they can introduce themselves. But starting out with the definitions of contribution analysis that we're working with here, you can all find the textbook definitions there. If you just Google contribution analysis, it's going to take you to better evaluation and other sites where there's going to be a sort of a 2-paragraph summary of what it is. But the spirit of contribution analysis, the idea is that it is a theory-based evaluation, right? So a theory-based evaluation is an evaluation approach that comes out of a set of evaluation questions that you want to answer. So before you start the evaluation, you know largely what you want to find out. If the program has worked in a particular dimension, it could be efficiency, efficacy, impact, etc. But you already have a set of questions. That's point one. And point two is that these sets of questions are normally based on an expected transformation, right? And this expected transformation is more often than not structured around a theory of change. It could be a logical framework. It could be another resource that gives you sort of an outline of the transformation, but you start out from a schema, from a structure that you want to verify in practice if it exists or not. Now that's different than exploratory approaches, in which you're going to the field a little bit like an anthropologist would go. You have your theoretical background, but you really want to start from scratch and see what's going on in the field and take lessons from using a cumulative, more inductive method where you actually don't make presuppositions about the expected transformation. You try and identify signs of transformation. So that would be sort of a non-theory based, more empirical, more blank slate type of evaluation. Now, contribution analysis requires a theory of change. So in the beginning, there's a change mechanism that needs to be in place. More than that, there need to be cause and effect questions that you need to address. So the program may have a theory of change, but the evaluator needs to understand how the transformation is taking place. So what causes what? What is the outcome of a given action? And what are the other contextual aspects that need to be taken into consideration for this outcome to take place? So the narrative of the theory of change, the assumptions and the causal mechanisms normally are up to the evaluator to develop, right? So the evaluator is going to develop this theory of change or improve this theory of change or refine the theory of change, and then gather evidence to see if the results were achieved and if the causal links are there. Because sometimes you may have achieved the results that you expected to achieve, but through different means, right? It could have been more roundabout or simpler than you expected initially. So that's also something that the evaluator in the process of contribution analysis identifies and systematizes, right? And towards the end, what you're doing is writing a contribution story based on the empirical evidence that you've gathered, and you're producing a theory of change that is essentially much more accurate than it was at the beginning because it's supported by evidence, right? And so once you have that, you have a piece that tells your evaluand, your client, but also the donors and the stakeholders, how the change came about or didn't. And you can issue actual recommendations that are based on empirical findings to say, here's how you improve. Here's how you make it better. So that's the general idea of contribution analysis. It's a very broad sort of approach, but has that strength of at the end, you knowing a lot more about the program and having a lot more empirical support to your theory of change than you had in the beginning. Within contribution analysis, there are different subsets of techniques and approaches that may be used or employed. I'm not going to go over that today. You can find it on the internet, and we can actually hopefully this year still discuss those other approaches. So without further ado, I'd like to introduce our two guests here. One is Pauline Moclet. She has been an evaluator of Eval for over 6 years. And she has done work in Mozambique, and she's going to bring her experience there using a type of contribution analysis. And she's been to the field, and she worked in the proposal for this evaluation, so she knows a great deal about the limitations and the virtues of contribution analysis for this particular experience. And then she's going to hand it over to Sara San Giuliano. She is also a consultant at Eval. She's been with us for a year or so. She's done wonderful work in Madagascar, taking a sort of a broader approach to contribution. Her work involved sort of a two-pronged approach. She oversaw a baseline research that's going to become an impact evaluation in the future, so in the nutrition sector, so about nutrition practices with younger children. But she also did a prospective evaluation using qualitative tools that in itself is a contribution approach, because she worked on building a theory of change. So those are our two guests for today. I hope you enjoy. Towards the end, we're going to have a moderated discussion. So I ask you, as our participants present, that you use the chat box to ask your questions. I'm going to be jotting down those questions, organizing them so I can bring them back towards the end to entice the discussion and to spice it up. Once again, thank you everyone who showed up. I'm very much looking forward to interacting with you towards the end. Okay. You can go ahead.
So I can start with the first.
Oh, you may, Sara. I'm sorry, Sara. I thought Pauline was starting, but it's fine. The order doesn't matter much. Go ahead.
Okay. Okay, so good morning, everybody. I won't add other additional details regarding my profile. Fabrizio said too much either. So I will go directly to present the case study of Madagascar, of the evaluation that has been a quantitative and qualitative evaluation of pilot project in Madagascar concerning food security and nutrition, mainly nutrition of women, breastfeeding women, and children under 5 years old. The intervention was focused on three specific components. The first was related to the specific nutrition action. The second was to the sensitive nutrition action, and the third one was much more a mainstreaming of the governance concerning nutrition. So capacity building at institutional level, at the central level and local level. The intervention was, we can go ahead, please. The intervention outcomes were mainly related to the three components: introducing or reaching diet diversity, improving nutrition of the targets, and health status. The observed effects mainly has been related to the awareness that has been raised regarding the diet diversity, and some new attitudes regarding diet diversity introduced in the household targeted, and the healthcare that has been improved. Causes of those effects are related to several factors which are external to the intervention and internal, and are can be related to the intervention directly and to the contribution of the intervention, but also from the contribution of other intervention that are ongoing in the same area. The intervention has been also object of a theory of change that has been elaborated in due course, and actually the theory of change has focused on the vision of strengthening the community resilience and as well the situation, the well-being of the targets. However, and several factors has been introduced included in the intervention, which were not conceived at the very first design stage. We can go ahead, please. Thanks. However, what happened? Yasmin, thanks. However, what happened, it has been that considering the fact that the theory of change has been elaborated afterwards, at very end of the execution, some of the factors that has been considered in the theory of change was not sufficiently included in the output, in the input and the output of the intervention, and for this reason, what happened is that the contribution has been a little bit weak regarding the reaching the community resilience enhancement. Can you go ahead, please? Yes, thanks. And so we can say that there are, for example, women which were engaged in improving in taking care of their children at the infant or young children under 2 years old, for example, were not so attentive to take the same care of their own health. So these the activities that were benefiting the infants were not benefiting at the same time the women. So this is quite a good example to understand what when a theory of change is elaborated during the execution, and some factors that has been considered in the ongoing process of the implementation were not embedded sufficiently in the implementation, in the execution, and so the consequence has been affecting. It was affecting the outcome in terms of reaching a better and improved health care or health status of the women targeted. In fact, when we want to work in improving also the women health care, we should involve all the community members or household members, which was not the case for this intervention. Can you go ahead? That's why during the evaluation, we had to review a little bit to retailor the theory of change in order to introduce elements that could be really factors which helps to break stereotypal patterns, which were mainly the involvement of fathers and husbands of a specific household in the healthcare of the children. So to come back to the tools that has been proposed for the evaluation, and in order to take into consideration and to include a contribution analysis, a robust contribution analysis in our evaluation, we organized the tools, quantitative and qualitative tools, in taking into focusing on particular sectors that was conceived to be addressed, or that were actually object of the pilot extension of the intervention, considering that the intervention was expecting to have a second phase and an extension in surrounding district of the first targeted district, and extension was focused on strengthening the nutrition sensitive activities rather than beyond the geographical extension. So we took from can you go ahead, Yasmin, please? We took from the again, this is the graph that we presented as a proposal for the review of the theory of change. Yeah. So the tools that we tailored, we presented, and we used were question and focus group patterns, which include hygiene and water access sectors questioning, and in order to understand, in order to inquire households, what and beneficiaries, how they do access, how they do what they were their level of use of water, for example, or the level of awareness regarding hygiene, which was the two elements that helped us to understand if the intervention were really bringing out some specific contribution, and what we apart from also in quantitative analysis, in quantitative surveys, we used also the counterfactual group control in order to understand the benefits coming directly from the intervention, and not from the overall project that were implemented in the area. So what we analyzed was that we found actually the effects directly generated from the intervention. Can you go ahead, please, Yasmin? And which were related specifically to again the next slide, please. Specifically to the awareness that has been raised on diet diversity, and to the VSLA experience, or the Village Saving Landing Association. Those two elements were the specific elements, factors that brings us to identify the specific contribution of the intervention of the intervention evaluated, because the others, because the dynamic that VSLA brought and the dynamic that the community nutrition sites brought on the awareness of the diet diversity was really strictly related to the intervention and not brought from other activities or other casual or other causes related to the context on the geographic situation of the area. In general, the other effects that has been generated by the intervention related to the healthcare improvement and specifically of the children were not strictly related to the intervention, but were encouraged or were benefits coming also from other causes. Can you go ahead, please, to the last one? Related to other causes and other activities that were ongoing, coming from the national initiatives like vaccination campaign promoted by Ministry of Health, or other intervention of other donors focused on health, hygiene, and water access. We arrived to the conclusion that all the benefit coming from that have impacted positively the household, coming from health and hygiene awareness, were not really strictly related to the intervention that we have evaluated. Because we found a greater benefit also in other villages that were not targeted by the intervention. And for this reason, it was obvious that the consequence has been related, has been brought from other activities. So starting from tools, fine-tuning, adapted to find out, to sort out with the solid contribution analysis, and thanks also to the second phase of the intervention, we were able to come out with almost clear contribution of the intervention evaluated. Thanks.
Thank you, Sarah. Thanks very much for the presentation. Everyone, feel free to ask your questions in the chat box related to the content of Sarah's presentation or to contribution analysis in general. We'll be happy to discuss them towards the end. Now I'll pass it on to Pauline, who's going to discuss her experience with contribution analysis in Mozambique.
Hi, everyone. Thank you very much for this opportunity to tell you a bit more about this case in Mozambique. So my name is Pauline Moclet. I'm an evaluator at Plan Eval. Just to give you a bit more information on my background. So I have a background in economics and management. And I joined Plan Eval in 2017. I've been working both with the management of evaluations as well as with the evaluation itself. In the beginning, I worked more with quantitative studies, and as mentioned by Fabrizio in his introduction, in the latest years, we've been doing a lot more of mixed method approaches and a lot of contribution analysis. And so here today, I will be presenting, next slide, please, a project that was conducted by Plan Eval in Mozambique, where we actually used a methodology that's not exactly the contribution analysis, but the qualitative impact assessment protocol. It's also called the QUIP. So it's part of the same family as the contribution analysis. So it's a theory-based evaluation. The approach draws on the contribution analysis, but it has some specificities. So comparing with the presentation we just had from Sarah, I will be focusing less on the results of the evaluation itself and more on the methods that we used and some of the lessons that we learned from having implemented it in Mozambique. So looking at the qualitative impact assessment protocol, the QUIP, the particularity is that the beneficiaries are really put at the center of the evaluation. So we really rely on beneficiaries to understand the changes that were caused by the program. And we do so by asking the beneficiaries themselves about, what changes they observed, either positive or negative, in their lives or in certain aspects of their lives, which are related to the program, of course. And we try to understand from their perspective, what are the factors that are behind those changes. Okay. And so through those discussions, we try to understand, what are the factors of change? So what changed? And what caused those changes in order to build a causal claim. Next slide, please. So the QUIP has some key features, but which are also relevant for other evaluation methods, such as the contribution analysis. And by the way, the QUIP can also be used in a complementary way with a contribution analysis. And what's important to understand with these key features is that these three key features really try to bring more robustness and more credibility to our findings, considering that we're putting the beneficiaries at the center of our evaluation, right? So we want to make sure that whatever the beneficiaries tell us is reliable and that it is sufficiently good evidence for us to say that the program led to certain results, right? And so one of the features that we put in place when doing a QUIP is the blindfolding. So blindfolding means that we're going to interview the beneficiaries without mentioning the program that is being evaluated. And so the way to do that is to ask them very general questions and to then refine and sort of understand the changes that occurred. And so before I mentioned how we do the blindfolding, the idea behind it is that we want to avoid that beneficiaries are going to give us biased answers, right? So that they maybe will talk very positively or more negatively about the program than it is than is the case in reality. Maybe some beneficiaries might want to talk very positively about the program because they think that they will get certain benefits in the future if they talk positively about it. Even if you tell them right from the start that they won't get any benefit out of doing the interview, there might still be a tendency for them to do that. And so the way to avoid that is to do some blindfolding. So we ask them, questions without mentioning the program that's being evaluated. And so we do that by starting with very general questions about, what their habits look like. For example, if we're evaluating, we ask them very general questions, and then we sort of go and refine and try to understand what changed in their lives with regards to these habits. And then normally they will by themselves mention the program. And once they mention the program, we can then, ask follow-up questions and sort of really try to recreate this causal claim. So a second key feature is the transparent selection of cases. Again, thinking about the fact that we're putting beneficiaries at the center of our evaluation, we want to avoid criticism that we did cherry picking, right? So, your program shows very positive results, but you only interviewed people that just happened to have a very good experience with the program. So in order to avoid this criticism, we are very transparent in the way that we select our cases. So the QUIP methodology actually proposes different strategies depending on the situation in which we are. So depending on whether there is a list of beneficiaries in place, whether there is a theory of change in place, and whether we have some outcome data. So I don't have time today to go over each strategy, but the idea is really to be transparent about the strategy that is being used, so as to avoid that people might say that we cherry-picked the cases, okay? And then a third feature is with regards to the data analysis. So the QUIP uses codification of data. The particularity here is that codification is very targeted. So, basically with codification, you can determine what your codes are. With the QUIP, we're going to focus on influence factors and change factors. So really looking at causes of change and the change. And through that, we're going to be able to map out a causal map, basically. So actually the software that is recommended for this codification is Causal Map, which is quite intuitive to use. So I think it's not so difficult for someone who's never used it to learn it. Yeah, next slide, please. Okay, so now looking at how we use the QUIP in practice. So we used the methodology for an evaluation of a social protection program, which was implemented by one of our clients in partnership with the national government in that country. So it was a post-emergency response program to the COVID-19 pandemic, and the implementation period was quite short. Next slide, please. So you will see some pictures from in the field, and as shown in the pictures, next slide, please, we conducted QUIP interviews. We did most of the interviews on individual settings, but also some interviews were conducted in a group setting. We managed to do the blindfolding. However, it was a bit of a challenge because we weren't only looking at, let's say, QUIP evaluation questions, but also to other more traditional evaluation questions about, the relevance of the program, the effectiveness, etc. And so we were doing both QUIP and non-QUIP, more traditional interviews. And so it was a bit of a challenge to make sure that the people that were doing the QUIP interview weren't aware of the fact that we were evaluating that program, considering that with other members of that same community, we were having a discussion where we clearly mentioned right from the start the program that was being evaluated. For the selection of participants, there was actually a list of beneficiaries in place, and there was even some monitoring data that would have been very relevant for the selection of cases. However, at the time that we started the evaluation, those lists were not complete. So in the end, we didn't manage to access those lists. And we ended up having to do more of a purposive sampling where we asked, the leaders of the communities to indicate people that benefited from the program, making sure that there was enough diversity in the cases. And in terms of interview codification, we used the software called Causal Map. And on the next slide, you will see an example of some of the causal maps that we created. The program is in Portuguese, so you will see that the map is in Portuguese. But basically here we looked at, for example, we started by asking questions about, the situation with COVID, how did it occur? What changes did it bring about in your life? So people would mention, well, there were restrictive measures in place and we were afraid of the disease. And as a result, there was, an economic recession, which reduced our revenues. The schools also closed. Next slide, please. And then eventually, asking them about like, okay, how did you face the situation? For example, your revenues reduced. Like, how did you deal with the situation? How were you able to continue feeding your families, etc.? At some point, they would then mention the cash transfer, which they received from the program. And from there, we could then ask like, okay, and how did that cash transfer help you? So they would mention, improvements in their quality of life, an increase in their purchasing power. Some people, but not a lot, mentioned an increase in their savings. They were able to reimburse debts that they had incurred, to face the pandemic or the reduction in their revenues. And just to mention, the numbers that you're seeing between each arrow are the number of people that mentioned that change. And I will comment on that later, but it's interesting to see that some changes were mentioned by almost everyone, like by a lot of people, while some were only mentioned by a couple. Okay, next slide, please. Okay, so some reflections on the use of this methodology. So first of all, the three key features that I mentioned in the beginning, they are very important, again, to bring robustness and to bring credibility to our findings. Blindfolding is a very important one to avoid, this bias in the response from the respondents. However, it's not always easy in practice. And so, for example, at the moment, we're about to use the QUIP methodology for a new evaluation, which is actually a WASH intervention. And in that case, I think the QUIP will work very well because it was a program that was implemented, but people on the ground weren't really aware of the fact that this was actually a program. Like the program hadn't been named, people aren't really aware of the name of the program. And so in that case, a quiz might actually be a very good method, because they won't necessarily associate our interviews with the evaluation of that program. About the number of mentions that we see on the causal maps, it's just important to mention that these should be interpreted carefully, considering that we're really opening the conversation and letting the respondent mention the changes that he found important or not. So it's not because just one person mentioned that he managed to increase his savings that he's the only one who managed to do that. So it's just the only person that mentioned it. So it's important to take into consideration those numbers, because clearly some results are more mentioned than others, but you need to be careful in your interpretation. Also, to bring more robustness to your data, if there is a possibility to triangulate with monitoring data, that's always super relevant. We managed to do that with this project in Mozambique, and yeah, it was really good to be able to do that. And finally, one important point that really came out of this evaluation in Mozambique is that the QUIP is less ideal as a method when you're trying to observe changes around a sensitive topic, like, for example, gender-based violence. So, because from the program, there was a component that was really the cash transfers, and then there was another component that was about communication and social and behavioral change, including around gender-based violence. The problem is, you ask the question to people, in the communities, like, how was the situation at home? Was there any change? Is there, do you have any issues at home, etc.? Trying to get people to talk about those topics, but there was a huge taboo. And so in the end, the QUIP in that case is not the most appropriate method, I would say. Because people don't really talk about it. And if people don't talk about it, then you can't really, observe any changes or draw any conclusions on that. So that's it for me. Do not hesitate to add some questions in the chat. Also, if you're interested in using, or you're considering using the QUIP methodology for one of your projects, do not hesitate to reach out. We'll be happy to help. Thank you.
Thank you, Pauline. Thanks everyone for the questions. Keep them coming. I have them on the chat box, a few, which we're going to get to in a minute. So we now move to the discussions of the topics that were approached. I'm going to start out with the questions from the audience and then introduce some of my own. I think both of you introduced some very intriguing issues related to the relationship between data and the theoretical approach, and how do we make claims about contribution, and so we're going to get into that in our discussion for sure. So I'm going to start. There's a question by Joseph or Josephine. You're asking us to share the presentation afterwards. We'll definitely do that. Everyone who was on the mailing list will receive this presentation shortly after the meeting today. So yeah, definitely you will receive the presentation. Nati asks us where we can find a simplified reports of these experiences. If you all go to our webpage, you will see that there is a tab on top of the webpage that says papers. And there, if you click there are most of the reports that we've published already related to our evaluations. Obviously not all of our evaluation reports are there. Some which are ongoing are obviously not published, and others they belong to the client, and the client for one reason or another has not disclosed them. But if you go to our webpage under papers, you will see that there is a large database of evaluation reports that we produce and that are public. Third question by Michelle, and she asks Pauline, how can she access, or could she access the interview guide for the semi-structured interviews for the blindfolding? So that's for you, Pauline.
Yeah, I can check with, of course, we have to check with our clients, but if there isn't an issue with the client to share those tools, I think there's no problem. I could share them with you.
Great.
But also, just if you have a more specific question about the tools, let me know, because I can tell you a bit more about them here if you have a specific question.
Okay, Michelle, if you want, you can add that to the chat box. Also related to blindfolding, Pauline, a question from Marta. Marta asks, in blindfolding, do you ask participants to compare the situation before and after the program? And how do you draw conclusions about the impact of the program?
Yeah, so what we did in this case, indeed, we sort of, asked them. What was specific about this case is that, so COVID occurred, right? And the program was only implemented as a response to that, right? So there is a period between the start of the COVID and the actual, when they had to deal with the restrictive measures, their income would go down, etc. And then there is the after, once they receive the cash transfers. And so we really asked them questions about those. And as I showed in our slides, we have, a causal map for showing, what occurred as a result of COVID, and then also some causal maps looking at, what occurred as a result of the cash transfer. So yeah, we really try to understand how was the situation before and after in order to really understand what changed as a result. In terms of how we can draw conclusions with regards to the impact, here I would say, but of course Fabrizio can complement or other participants as well. We're really relying on the beneficiaries to tell us what changed. So with Equip, we're not looking at a counterfactual, we're not making any comparisons, we're not, we're sort of going around this issue of attribution by really relying on, what beneficiaries are telling us that changed. And we're sort of assuming that that is right. And that's why we have those key features to make sure that, that we can actually trust what beneficiaries are telling us and that it's sufficient evidence for us to say that the program had an impact or not.
Thanks for that, Pauline. I hope that answers the question. If not, you can add to the chat box, Marta, further questions. Just to complement on what Pauline said, yeah, I mean, contribution analysis does not concern itself with attribution, right? So with separating out the extent of the transformation that is due to the intervention, in that case, the program. So when you do randomized control trials or semi-experiments, the stuff that people do at JBL, and that's widespread now, you want to know how much of the outcome is due to your program. So you put a number figure on that, you establish a magnitude. Contribution does not establish a degree. It is looking at the different causal factors. And of course, since it's a qualitative approach, you have evidence from interviews that tell you, what was stronger and what was weaker. But we're more concerned at mapping out the different factors of impact than actually putting a figure on it. Thank you for the question. That's a really important distinction between contribution and attribution. We have a question from Carol, which is about the diagram that Pauline showed a few slides earlier. On the causal map, what do RDB and SN stand for?
Yeah, so I didn't go detail that, but when you do the codification with causal map, you might want to put some codes. For example, in some cases, we would put a P or an N in some brackets. P would be for positive change, N would be for negative change. So, and this is really from, re-listening to the audios. In some cases, it's not clear whether that person sees that change as something positive or as something negative. And so you would clarify that by putting a code. With the RDB, if I'm not mistaken, it's related to revenue. So we also put in the beginning of the code also some categories. So if there was something related to wellness, we would put a code for all the changes that were mentioned related to wellness. If there was a change more related to people's revenues and economical situation, we would mention that in the beginning so that we sort of are quickly able to identify to what category each change belongs to. So thank you for that question, because I didn't mention it out of lack of time, but it's a good.
Great, thank you, Pauline. Another question from Marta, now Marta J. She is asking if you, Pauline, used other sources of information other than people from the community.
Yeah, so we didn't only interview the beneficiaries, we also interviewed people that were more in charge of the implementation of the program, of course. So there were also key informant interviews, benefit interviews, and of course there was also the secondary data. So I mentioned it briefly, but there was also some monitoring data, post-distribution monitoring data that was being collected every time that people would receive a parcel of the monetary transfer. And so we would be able to also triangulate our data looking at this quantitative data. But so for the interviews, I don't have the exact list here of the people that we interviewed, but yeah, there were definitely also key informant interviews.
Another question from Josephine. Does QUIP fall into qualitative research? It's actually, I think I can answer that. Maybe Pauline can complement, but it's a qualitative impact protocol. So I think in principle, it falls into qualitative research, right, Pauline?
Yeah, it's qualitative in nature in the sense that we interview the beneficiaries, but of course it doesn't mean that you can't triangulate your data with quantitative data or other sources. But yeah, in terms of the method and the interviews we're doing, it's mostly the focus is on the qualitative.
Another question also about the specifics of the QUIP approach. I see people very interested in the specifics of it. That's great.
That's great.
About triangulation. So House of Grace, Grace, I assume, how did you triangulate using QUIP, and which approach did we choose? And that's related to the previous questions about how you triangulate the different sources of information for QUIP.
So I think I mentioned it before, but so yeah, we triangulated a lot with the quantitative data, the monitoring data, and with the key informant interviews. Those are the main sources of triangulation, I would say.
I think the question was more along the lines of how, not what sources. So how did you go about triangulating? Maybe what was the process that went into it? I don't know, the coding, the organization of the information.
Yeah. So typically for triangulation, we would work with an evidence matrix, right? So we want to make sure that when we answer an evaluation question, that we don't rely on just one source of information, right? And so by working with an evidence matrix, which sort of uses the same structure as the evaluation matrix, but focusing more on the evidence, we would look at the evidence from the QUIP interviews and then also look for confirmation or, disconfirmation maybe of these findings coming from other sources, right? And so always making sure that you have enough evidence to make those claims. I don't know if that answers your question.
If not, you can add to the box, Grace. There are two related questions, one from Monse and another one also again from Grace, and they're about isolating the program from other factors of impact. We've said that that's not our main interest is not to quantify, and we can't do that using that that method. And Pauline has already talked about triangulation. Is there in QUIP methodology, and maybe I think also Sara can add to that if she wants to, Sara, about how do you isolate the program from other factors of impact? Because I understand that, you know, when you interview people, when you observe data, sometimes in people's minds, it's not super clear what is due to the program and what is not, you know, either because they don't have a clear idea of what the program is about. And it's normal, right? Because the program is designed by management and by technical people, and the people who are beneficiaries sometimes don't understand, you know, where's this coming from? Is it from the government? Is it civil? You know, what is the program? And to a lot of people, it doesn't really matter so long as the change is observed. Now, so if you're working with evidence that comes from interviews, it comes from people. And if I interpret correctly, Grace's and Monse's question is, you know, how do you isolate really what is due to the intervention? I know Pauline spoke a little bit about triangulation, but Sara also mentioned that, you know, the contribution that we were able to draw wasn't so clear. She said that, you know, the intervention itself had a limited contribution. So I'd like to hear from the both of you, Pauline and Sara, based on those two questions, is how, as evaluators, knowing what the intervention is about, knowing what the intervention wants to achieve, how do we isolate it so we can attribute a causal effect to it?
Yeah, it's a very good question. And that's also, it's a very good point also. And that's why, you know, if you're considering using the QUIP approach or the methodology for your research, you need to be very careful about certain things. And that would be one of them, right? Because since you're not talking specifically about your intervention, you're sort of hoping that the beneficiaries will mention it by themselves at some point. They might not know the name of the program, and so they might be talking about another intervention, you know, and you will assume that it's related to your program when actually it's not. But in the case of this evaluation, it wasn't a problem because it was a cash transfer program. It was the only cash transfer program that was being implemented in that area. And as a consequence of the COVID-19 pandemic. So in that case, we didn't have that risk of having other interventions in place, which were sort of trying to do the same thing. But it's a very good point. And I would be very curious to hear from Sara, because she sort of mentioned that there were other interventions in place in Madagascar. Oh, you're on mute, Sara.
Yeah, actually, we relied firstly on the sampling, because I think the sampling of for both quantitative and qualitative surveys were quite key in order to understand the number of targets which belongs strictly to one intervention rather than others, or which are targeted by several interventions. In this case, you have a sort of you have the table, the simple table, the sampling tables, where you have all the households which are directly benefiting from an intervention. But apart from this, what we identified were specific inputs that one intervention was providing rather than the others. And so we try to focus our triangulation regarding those factors which were not in common with the other interventions. So for sure, for the evaluator perspective, when you are making your desk review and your analysis of secondary data, you have to also know a little bit more in details regarding the others intervention ongoing. But the point is, the most difficult is related to intervention that has been already implemented and achieved that has passed and left some benefits? How do you identify? And in our cases, it was crystalline clear. Always relating, we rely on sampling. When you sample your your control group, and in this case, we were a little bit helped by the fact that there were another intervention in which was supposed to start, but and helps us to sample those the group control survey, and actually in sampling those other household which were not beneficiaries, we try to identify characteristics. We try to really fine-tune the sampling in terms of finding the same characteristic or the same typo, let's say, in the same activities around. So it was the comparison. It was not so not so different, but what was the difference comes out really during the interviews, when you approach the same topic, like, as I said, IGEN, with beneficiaries and non-beneficiaries. So in our cases, it was really the sampling which were making a big difference and helping us in understanding what was really the contribution coming from the intervention we were evaluating, or contribution coming from past intervention or ongoing intervention, which were ongoing, which were from others.
And
Thanks
just to
very much,
underline
Sarah.
something, sorry, just to stress something that Sarah mentioned, is the importance of having a very good understanding of the context in which you're doing your evaluation during your inception phase, right? When you're designing your methodology, you need to understand those things, like what are the other interventions in place, who are the stakeholders, etc. So based on that, you can then determine the best methodology.
That's brilliant. Thanks very much, Pauline. Thanks very much, Sarah. Unfortunately, we don't have more time to pursue this discussion. We've already reached the 1 hour that was foreseen. I'd like to thank everyone who was present. We can follow up on this discussion by email. Just write to Yasmin. She's the person who sent you the invitations for this. If you want to get in touch with the consultants or pursue this debate, we'll be super happy to do so. And look out for the next edition of our Knowledge Exchange series. Thanks very much. Yasmin, do you want to wrap up?
Yes, I just want to, once again, thank you everyone for joining. The idea is to have this knowledge exchange series on a regular basis. I will be in touch with you all via email to share the presentation as well as the recording. This link will be up on YouTube, so you can rewatch the discussion whenever you want. And thank you so much again, Pauline and Sarah, for the participation. Thank you, Fabrizio, for the moderation, and thanks everyone for joining.
Thank you very much, everyone. Bye-bye.
Have a nice rest of the day, evening, or afternoon.
Goodbye.
Bye. Thank you.
Bye.